Hi, my name is Dr. John Holtzen, oral and maxillofacial surgeon at Alpine Oral and Facial Surgery. If you're watching this video, more than likely you or a loved one have either recently had teeth removed or just about to undergo this procedure. And we wanted to make this video available so you will have ready access to the most essential information following your surgery. One of the most important things for you to know is when to be concerned after oral surgery and when you should reach out to your doctor. Firstly, you need to know that you should never hesitate to call us, and we are always here for you. Oddly, patients with concerns often call their dentist or go to an emergency room if they're worried. Please contact us first with any concerns, and always remember that the doctor can be reached after hours or on weekends through our answering service by calling our main number. As we discussed in another video, typically you will feel progressively worse until about day 3 or 4 after your surgery, and then start to improve. You will still have ups and downs, but the trend should, from that point, be improvement. It is unusual for significant problems to occur during the early window, but if you're concerned about how you're feeling or you have a temperature above about 100.4 degrees Fahrenheit, call, and we'll always be happy to discuss this with you. After day 4, if you continue to get worse in any way, increasing pain, increasing swelling, fever, again, of above about 100.4, or anything else that seems to be changing for the worse, that is a reason to call. The most common problems we see following tooth removal are infection and dry socket. In spite of great surgical technique and your best efforts to follow instructions, these things will occur in some patients. Infection is the most common problem and will happen to about 5% of patients who have oral surgery, no matter what we do. If, after day 4, you continue to feel progressively worse, you have increasing swelling, and you have foul-tasting discharge or fever, please reach out to the doctor immediately. It is rare for signs of infection to manifest earlier than day 4 or 5, but if at any time you feel ill, have a fever, if your swelling becomes red, hard, and hot, or you have other reasons to be concerned, always call your doctor. Bleeding after surgery is not uncommon and can sometimes start up again even days after a surgical procedure. If this happens, just repeat the process described in the after surgery instructions by biting on gauze against the area that is bleeding for 1 full hour without disturbing the gauze. This will almost always make it stop. If you have profuse bleeding that will not stop, call your doctor. Dry socket is much less common in my experience, but it's probably the second most frequent difficulty patients experience. A dry socket occurs most commonly at about 5 to 7 days after surgery, when the blood clot from an extraction site gets disturbed prematurely. When this happens, sometimes the surrounding bone will become inflamed and very painful. This doesn't do anything to harm the patient, but it can be very painful for several days. The key to this problem is to manage the pain until it starts to heal. Sometimes this involves just oral pain medicines or sometimes other treatments. Contact your doctor for help. Having surgery of any kind is not fun. Please know it's our goal to help you not just have a great outcome, but to have the best possible experience as well. The most important message to remember is we are here for you throughout your recovery. Do not hesitate to reach out with your concerns or questions.